evening and welcome to This Is The Day. My name is Sarah Otieno. We are live on Family TV, also live on Family Radio. And we are also live in Nyeri and Meru. And in Nyeri, the frequency is actually 87.9 on Family Radio. And live in Meru with the frequency 107.7. So if you are in these areas and if you also know anyone who is listening from these areas, you can always tell them to tune in. And the frequency in Meru, I'll repeat, 107.7, and in Nyeri at 87.9 on Family TV and Family Radio, live in those new places. Now remember, the WhatsApp number that you can use to contact us from is 0786 316 316, SMS line 20316. Now let us look at how things are globally when it comes to the COVID-19 pandemic, and we will start with the numbers globally. Right now, we have 3,759,296 cases of COVID-19. We also have the number of deaths at 259,591. The numbers of recovered cases has increased to 1,258,746, and that is an increment from yesterday. When we look at the active cases that we have right now, we have 2,240,960 active cases, and so far 1,518,336 cases have been closed completely and completely shut down from the COVID-19 virus. Let us look at those cases that have been reported today. And in the last 24 hours, Russia is topping the list with 10,559 new cases, followed by Spain with 3,121 new cases. The USA has 3,021, and we have Saudi Arabia with 1,687 new cases in the last 24 hours. Iran follows closely with 1,680 new cases. And the number of deaths, Belgium today recorded 323 new deaths. We have Spain with 244, and we have Mexico with 236, USA with 183 new cases in the last 24 hours. Now let us look at it locally. And in our country right now, the government has now declared a lockdown in two of the worst affected regions in the country. That includes Eastleigh Estate in Nairobi and Old Town in Mombasa County. The two regions have been registering high numbers of COVID-19 positive cases, with the latest being 18 in Old Town and 5 from Eastleigh in the last 24 hours. Listen in.
There shall be cessation of movement in and out of Eastleigh area of Nairobi with effect from today, the 6th of May 2020 at 7 p.m. for the next 15 days. There shall be cessation of movement in the area known as Old Town in Mombasa with effect from today, the 6th of May at 7 p.m. for the next 15 days. There will be closure of any markets, any restaurants and eateries within those two areas. That is the area of Eastleigh in Nairobi and Old Town in Mombasa, with effect from 6 May 2020 at 7 p.m. for the next 15 days.
Well, that means if you are in Eastleigh past 7 p.m., then you will not be allowed to move out of that area for the next 15 days. And that also applies in Old Town in Mombasa County. Now, on Tuesday, Eastleigh recorded 29 cases, with authorities claiming the residents of the two areas were flaunting the COVID-19 safety measures announced by the government, including keeping safe distance. Now, the other regions being considered as hotspots that may go down the same way if actions are not taken include Kawangware in Nairobi. These are some of the places that they are watching out for. And now Kenya has recorded 47 new cases in the last 24 hours, bringing the total number of infected people to 582 in our country. That as 2 people have succumbed to the COVID-19 pandemic, and these 2 passed away in their homes in Mombasa County.
Today, we have a new high of 47 persons who have tested positive to the disease. Thus, Kenya now has 581 people who have tested positive from the beginning. The cases in Mombasa are mainly in Old Town, with 18 cases, 18 additional cases being from the Old Town, and 5 additional cases here in Nairobi, again going to Eastleigh. In terms of number, in terms of gender, once again, we have 31 who are male and 16 who are female. We are also lucky today that we have released 8 persons. 8 persons have been discharged, which brings the number of discharged persons to 190. On a sad note, though, I want to inform you that we have lost an additional 2 persons from coronavirus disease in Mombasa, bringing this number to the number of deceased persons to 26. But of more serious concern regarding those deceased persons is that both of them, aged 68 and 72 respectively, actually passed away at home.
Well, we have been having and receiving cases of people not going for testing, and they have been reported across the country, with others unfortunately dying in their homes, like the 2 that we have had today. Now, this has attributed to the high cost that they fear to incur, but now the government has said that they will take up the cost of COVID-19 testing and quarantine, and all this will be done in the government facilities. The CS explained this.
Further, the government has also said that the cost of targeting testing and quarantine and government quarantine facilities shall be met by the government. Kenyans should therefore forthwith not be afraid. Let me repeat that. Effective today, government quarantine facilities will be occupied by those told to do so by the Ministry of Health. We will be given that facility free of charge. This is to facilitate those who may feel that they do not want to go for testing because of the cost of quarantine. That is no longer the case.
Well, this is just one of the issues that has been disturbing a lot of Kenyans when it comes to the testing and even staying in the quarantine facilities. And it was discussed by Parliament amongst other bills that they discussed, and we'll be talking about that later. Also later, we will be talking about one of the health sectors that has been affected, and that is the maternal health. Thank you so much for making time for This Is the Day. My name is Sarah Otieno, and the WhatsApp number that you can always use to contact us from is 0786-316-316, SMS line 20316. Fanuel, thank you so much for tuning in today. Martin Dungu pia wewe na kuona, and have a blessed evening. Asante pia. We also have Cliff Omwenga, you're tuned in from Nakuru, Kaptembwa, and good inspiring songs, and be blessed. Be blessed too, my brother, and thank you so much for tuning in today. I also have Monica who is saying, I am tuned in from Nyeri. Hey, asante sana watu wa Nyeri for tuning in today. Well, let us go to the residents of Kariobangi, and now hundreds living in Kariobangi North, and that is in Nairobi, were left homeless after the government moved to repossess acres land which it says was reserved for the city sewerage system. Now, this repossession comes as the Ministry of Water, Sanitation and Irrigation strains to handle sewerage needs and water supply of up to the 9.3 residents of Nairobi metropolitan area. Now, only 50% of Nairobi has sewerage coverage. That is a big number. Now, the situation that has led to the pollution of water sources, rivers, and the environment as a whole, endangering the ecosystem and the people living within the environs of Nairobi. Now, despite this move, the question still remains, what next for these families? And especially during this time that we have the pandemic, how are they going about this?
Kuiba, wengine wanasika wanawake huku. Imekuwa sana, wanawake wamesikwa leo cha nguvu juu serikali wakati ilibomoa hapa walienda, hawakulinda watoto, hawakulinda wamama, wazee. Tumelala na baridi, vitu yetu imefunikwa na mchanga na tingatinga.
Njia hii barabara hii side imefungwa, hii side imefungwa. Kwenye mnaweza tolea vitu yenye mmebaki nao kidogo, hata kama ni manguo za watoto hakuna. Leo bado tuko hapa tena tulaleleo kwa hii baridi huku tu. Juu sasa hatuna kwa kuenda. Pesa yenye na mtu wako amejipanga. Watu job walivutwa. Sasa mna expect watu wafanye nini? Na ukikuwa mwizi unauliwa.
Na mtoto wa 2 years. Sasa venye tulibomolewa huku, nilimpeleka kalala kwa jirani. Sasa nimeenda huko jirani na ananiambia ati mtoto amepotea. Sasa kama kuna mwenye anaweza kwa muone huo mtoto anaitwa Angel, tafadhali apige hii namba 0706 20 ama mletee huku.
Kama watu wako kwa shamba ya nani, hata sikuta wale wako mashamba ya wenyewe binafsi, hawafai kufukuzwa kama maumbwa. Kuna katiba Kenya na katiba inapea kila mtu nafasi na inapatia kila mtu uwezo. Serikali haifai kufukuza mtu bila kumpa mahali ya kwenda. Hii serikali inapiga watu kama maumbwa.
Well, that is really sad from the residents of Kariobangi North, and the parent is still calling for anyone who's seen the child to make sure that at least they contact the family or even return the child back to their family members, and that is the plea of a very, very scared mother during this time. Now, more than 40 Kenyans have returned home through a government-facilitated travel plan. 20 people arrived from Egypt last Friday and another 21 jetted in on Monday. Another group jetted in yesterday evening from the United Kingdom. And now the Transport Cabinet Secretary James Macharia, he's saying that more flights are still being expected to our country in the course of this week, bringing Kenyans back home.
Those are the 3 issues which have been delaying, for example, this flight from India, because the numbers we have are many. We have a flight which is ready to go to India, Dreamliner 787 to carry 234 passengers, but we are waiting for them to get all those certificates because they will not board without those certificates. Plans have been there, but 3 key conditions have to be met, and this is critically important. First, those people coming must have a certificate saying they are COVID-free. Number 2, they must be Kenyan citizens. Number 3, when they get here, they must sign to say that they will allow themselves to be quarantined.
Well, it's also important to note that the government, through the Ministry of Health, and that is CS Mutahi Kagwe, pointed out that when these people are being brought in from India, they will be released under the care of their doctors, and that is where they will be quarantined and observed for the next required number of days before they are released back to their communities. So he says that restrictions and regulations are still being put into place to avoid the spread of COVID-19 amongst Kenyans. Now, after the government gave a directive for everyone to wear masks, Embu County has reported a huge shortage of these masks. Different ward representatives in this area have faulted the county leadership for not being vigilant in ensuring the residents have access to these masks, and they suggest that the tenders be given to the local polytechnics in the area to ensure mass production and availability to all people.
Niko na Shauri, niko na Grogon na pia pande ya Daras. Ukienda huko ile ukweli sisi hatujaona mask. Ukikuja hapa town serious, ukikuja ukute hawkers hakuna mask. Ule ambaye alipatiwa mask aende apatie watu, yeye kazi yake ni kuuza, akipiga siasa na mask za watu wa Kilimari. Lakini tuseme tumepatia institution moja, tusaidie mtu mmoja waelea, kuna maskini wengi sana huko. Mtu ambaye amenunua serehani, huyo ni mtu maskini na ni vile ndio kujimudu. Kwa hivyo kama kuna opportunity sisi kama county government, hawa mama wote wako huko wanajenganga masuti na uniform, ni wachukuliwa wapelekwa mahali pamoja, watengeze mask, hiyo pesa kila mtu apate kidogo kidogo.
Tuko na fununu ya kwamba ile pesa inaweza kupewa mtu mmoja kutengeneza yale maneno ya kutengeneza kama hizi vitambaa. Serikali ya Embu ni ijue ya kwamba kama tumesema ni village polytechnics zipeano kila mahali, tusiangalia ya kwamba tunaona ni mtu mmoja kama Henry anapewa hizo pesa zote afanyie kazi. Hiyo tunaangalia sana. Kwa hivyo serikali ijue ya kwamba tuko macho. Coronavirus is real. Na tukiangalia vile serikali inachukulia hili janga la coronavirus, naona ni kana kwamba mwananchi wa Embu County ako katika hali ya hatari.
Well, remember, this is a requirement by the government, and if you fail to wear a mask, you can be charged up to being jailed for 6 months or even fine of up to 20,000 Kenya shillings. So continue being vigilant. Thank you so much, Vincent Mulinge, for tuning in all the way from Thika. And I can also see my friend Dorcas tuned in from Mombasa. Asante sana for tuning in, and be blessed too. Thank you so much, Marianne, for your feedback and for tuning in today. I can also see one Tracy tuned in from Nakuru and is saying thank you so much for the inspiring music and for the updates. We bless the Lord that you could tune in today. Now, Kenya has one of the world's highest maternal mortality rate, and 1 in every 26 babies dies due even before they reach their first birthday. Now, studies show that exposure of women's group in low-income countries can reduce neonatal mortality to up to 20%. Now, yesterday, the health CS Mutahi Kagwe applauded midwives for helping in the department during this time of the pandemic.
In the midst of this pandemic, and midwives are the primary caregivers for millions of women and newborns before, during, and after childbirth, and also offer women and girls essential counseling and education on reproductive health. As a government, we are delighted to celebrate the midwives in Kenya for their tireless commitments and professionalism in delivering safe, effective, respectful, quality care to mothers and their babies. We can't thank you enough. And thank also all the other nurses, clinical officers, doctors, and every people working in laboratories. We are extremely grateful. But let's not forget that midwives included, and midwives in fact, are particularly vulnerable to the coronavirus disease. This means that pregnant women and babies are at risk too, which explains why we have got some 2-year-olds that have also been affected by the disease.
Well, it is very unfortunate that we have young children up to 2 years old and even 6 months being affected with the disease. But it is also unfortunate that resources are often diverted from maternal health care during such crises. And the COVID-19 pandemic is making it increasingly difficult to provide adequate maternal care worldwide. So how can you make sure that during this time, if you are an expectant mother, you are safe? And what are some of the challenges that are facing the maternal health care system in our country, and especially during this time of the pandemic? We are now joined with one Dr. Eva Okello, who will explain more about that. Evelyn Okello, thank you for joining us and creating time to actually talk to us this evening.
Good evening, Sarah. Thanks for having me.
All right. I want us to dive straight to the meaning of maternal health, because most people maybe will not understand what we really mean, and medically speaking, what is maternal health?
Okay, so basically, as we know, health is defined as a state of well-being, physical, socially, psychologically, and even emotionally. So when you talk about maternal health specifically, we are talking about the well-being, physically, socially, emotionally, and even basically all aspects of health regarding a lady who is pregnant, who is in the process of delivery, or just after delivery. We normally push it up to 6 weeks of delivery. So basically maternal health is a state of well-being of a woman in the state of pregnancy, during delivery, and up to 6 weeks post-delivery.
Okay.
That is what we define maternal health as to be.
All right, sawa. And it's very unfortunate that maternal mortality and child mortality in our country is quite high. So what are some of the causes of this high rate, especially in the rural areas in Kenya?
Okay, so basically when you talk about causes of maternal mortality, we normally divide them into direct and indirect causes. So the direct causes of maternal mortality are the ones we attribute directly to the status of pregnancy or aggravated by the condition of pregnancy. And in our country currently, the main causes of direct maternal causes of maternal mortality are 5. The main one being hemorrhage, mainly postpartum hemorrhage, which is basically bleeding post-delivery. The second one would be hypertensive disease in pregnancy. Mainly we talk about what we call preeclampsia or eclampsia, which is a specific type of hypertensive disease just within pregnancy. The other cause will be unsafe abortion, and the 2 other causes will be infections and an obstructed labor. So basically those are the 5 main causes of mortality, maternal mortality in Kenya and even in the world, really.
And you talked of indirect causes. Maybe can you help us understand what are indirect causes and how do they affect pregnant women?
Okay, indirect causes would not be attributed to the status of pregnancy per se. It could be causes of death just due to anything else. Like a pregnant woman would probably have HIV and complicate, or would have malaria or tuberculosis, or even being involved in an accident. So those are indirect causes because they are not attributed to the status of pregnancy and they are not worsened by the fact that a lady is pregnant. So those ones, you don't really talk about them when you talk about maternal mortality, because anyone else, pregnant or otherwise, would actually be affected by the same. So that's why we dwell on direct causes mainly.
And when you talk about mortality, it cuts across both the mother and the child, right?
Okay, yes, but now when you talk about maternal mortality, it's just mortality for the mother. We also have, in the pediatric sector, we also have neonatal mortality, perinatal mortality, infant mortality, which is a different, which would be a bit different from the topic of discussion today. So maternal mortality is just death of the mother because of the fact that she's pregnant or because the pregnancy worsens whatever condition she may have. All
right. So when you talk, am I right to say that the COVID-19 pandemic, if I am getting you right, can we categorize it under indirect causes of mortality?
Yes, sure. Yes, we can identify, we can categorize it under indirect because, as we know, first of all, it's a disease we do not know much about, but as it is not really caused by pregnancy. So we are not sure if it would be aggravated or worsened by the same, because for that we'd have to do further studies, given that it's a new entity. But as it is now, yes, definitely it's an indirect cause of maternal mortality.
And really, there is a lot of effect, and especially right now. And yesterday we were celebrating the Day of the Midwife in the country, and they actually tend to be taking up, leave alone the nurses, and now going to hospital to deliver because of the pandemic. Most midwives are actually taking up that role of helping mothers deliver. And when we talk about the midwives, and I believe that that is one of the solutions to the high rate of mortality during this time of the pandemic. Are there any other solutions that can be put in place to make sure that the rates are dropping?
Okay, so one of the things that we have noted, first of all, we even saw a few cases on news, is that a number of women were actually dying or getting complications because of some of the implications of this COVID-19. As we know, the government has a curfew, so we saw a number of complications and even mortalities because, you know, a woman goes into labor in the evening or at night. They are afraid of getting out, or maybe they don't even have means of transport. And because of the curfew that's in place, there's actually a lady who had to wait till morning to go to hospital, and in the process, she actually she died, and of course, the baby died as well. So that is one of the main things. Because of the implications of the pandemic and the curfew, we've actually had a few cases of delays of women getting into hospital for proper care. At the same time, you know, people, there's this fear. People just don't want to be in hospital, you know. Because we say, what if I go to hospital and get infection? So we find a number of women actually preferring to deliver at home or using the so-called traditional birth attendants because they don't want to go to hospital and expose themselves to this risk of getting the COVID, getting infected by the COVID-19. So those, I'd say, are the main two things that we have seen for now. And of course, there's also this shift of focus, such that all the healthcare workers, the policy makers, everything is really shifted towards addressing the pandemic, such that other issues that are not related to this pandemic have sort of been neglected, if I may say so, because we even find that the continuous medical educations, the webinars we are having, everything really is focused on fighting this current pandemic, such that the other issues related to health have really taken a backseat. So I'd say those are the main issues that we have now. And of course, also looking at generally, even post-pandemic, maybe what we can do to reduce the rate or the numbers of women dying because of pregnancy. There are a number of things, So first of all, the government needs to come up with policies that are really focused on trying to reduce maternal mortality and even neonatal deaths. So we need policies, we need lawmakers to come up with policies and advocacy issues. That would be number one. The other main challenge, especially in the rural areas, is infrastructure, which actually causes what we call the third delay, which refers to delay in actually getting access to healthcare. Because we find we have very few hospitals or healthcare facilities in the rural areas. At the same time, we have the terrain, the roads are poor. We don't have means of transport. We don't have ambulances. So that would be one of the other main challenge that will be contributing to maternal mortality. So that could also be addressed. And of course, we need more healthcare workers, more midwives, more trained obstetricians, gynecologists, more community health workers, more education to the women on the need for, attending clinic when they're pregnant and delivering in hospital, etc.
All right. And lastly, before I let you go, right now, maybe there is a woman who is expectant. What are some of the advice that you would give them to ensure that they have a safe pregnancy and at the end of the day have a safe delivery, despite the fact that there is a pandemic?
Okay, there's a concept we call safe motherhood. And really, safe motherhood begins even before pregnancy. So I know your question is addressing the pregnant woman, but as obstetricians, we like to start from even before they're pregnant, even before they're pregnant. So basically, we have what you call preconception care. So every woman in the reproductive age who desires to conceive and get a baby should ideally go for what you call preconception care, during which the doctor will look at her risk factors, her medical history, try and optimize her health condition before she gets pregnant, because as we know, there are conditions that put us at higher risk once we are pregnant, like diabetes, hypertension. So that once that is optimized, once they have good what you call hemoglobin levels, good nutritional status, then they are at a good condition to actually conceive and carry a healthy pregnancy to term. So that is the first thing, preconception counseling and preconception care. Such that will be taken through the process, the expectations, so that by the time you're conceiving, you're actually in an optimum, your health is at an optimum level so that you can actually carry a healthy pregnancy. So once the lady actually conceives, we have antenatal care. So we'd advise all pregnant women and even all women who are planning to get pregnant to actually take this seriously. But that the minute you realize you're pregnant, you actually go to your healthcare giver and you start your antenatal clinics. because then we'll be able to pick a few of the risk factors that actually contribute to some of the direct causes of maternal mortality that we have mentioned. So that will be number 2, attendance of antenatal clinics. And of course, it is very important that all women deliver in a healthcare facility. Now the government has made it possible because we have free healthcare, we have the Linda Mama, we have basically delivery is free in government facilities. So we should encourage all pregnant women to aim at delivering in a healthcare facilities under attendance by a healthcare worker. This, of course, has been shown to improve outcomes and to get a healthy mother and a healthy baby at the end of it all. So post-delivery, we have what's called postnatal care. This is actually normally neglected, and some women or mothers complicate post-delivery. So we should also encourage them to actually attend clinic post-delivery so that they can also, their health status and that of their baby can be optimized. So basically, those are the 4 main if I'm to divide them, there's the preconception care, there's the antenatal care, there's the care during delivery, and postnatal or post-delivery care. All pregnant women, I would advise them not to shy away from going for care because most hospitals have put in place checks and measures to ensure that, there's no infections and, the people don't get infections from the hospitals. So I'd encourage all women to actually, still seek antenatal care or even preconception care or post-delivery care even during this pandemic.
All right. Thank you so much, Evelyn, for sharing such knowledgeable information with us, and I wish you a safe stay even as you stay home.
Well, I'm staying home and working somehow in between. Yes.
Well,
thank you so much, Sarah.
Thank you so much and have a beautiful evening.
You too, Sarah. God bless.
Bye. Yes, that has been Dr. Okello telling us that there is no harm of expectant mothers seeking help, and especially during this time of the pandemic, because regulations have been put so that they do not interact with people that have the virus, or they are not exposed to the coronavirus. So if you are an expectant mother, it is advisable that you seek the required help. We're live on Family TV, also live on Family Radio. And Remy Kipchirchir, asante sana for tuning in today and saying that you have had the cases of coronavirus are up once more. And yes, in our country today, we have recorded the highest number of new positive cases of the COVID-19 virus. That is at 47 cases in the last 24 hours. So we need to continue being vigilant and also praying for our nation. Now, members of parliament are now demanding that the government closes its borders with the countries of Tanzania and Somalia to protect Kenyans from the COVID-19 pandemic. While contributing to a motion to amend the COVID-19 effects bill, the MPs claimed that since the Tanzanian government are not enforcing the necessary measures to contain the virus, Kenyan government should ensure that the borders are closed to keep off Tanzania from migrating the virus to our country. Tanzania and Somalia, of course, have recorded the highest number in the East African countries. And this is the MP for Gilgil, Martha Wangare, and had this to say.
Right now is actually the issue of our borders. I spoke about it when we met the CS Mutahi and CS Fred Matiang'i with the delegated legislation committee. The boundary or the borderline between us and Tanzania, the border between us and Somalia, Mr. Speaker, has to be actually closed down. We must not negotiate because the numbers that we are witnessing in Tanzania will actually affect our numbers as we are talking today. Mr. Speaker, the issue of Somalia, the borderline in Mandera and other areas, the Lamu border, Mr. Speaker, we must be very decisive as a country. Between the Ministry of Interior and the Ministry of Defense, we must totally lock down those borders.
Well, do you support this call by the Kenyan representatives to shut down the borders between Tanzania and Somalia and the connection to our country? Because yes, they are claiming that if they do not put the measures into place, they are endangering the lives of Kenyans. If you are in support or not in support of that, I want to know your view. The WhatsApp number is 0786 316 316, SMS line 316. South Africa is one of the African countries that has put strict measures, including a lockdown, to curb the spread of COVID-19. They have been on a lockdown for the last 40 days. Others have complained of mismanagement and misdiagnosis. Others complaining of hunger, which is one of the biggest challenges that has been facing these people from South Africa. But what is the condition right now in that country? We are joined by one journalist by the name Gia Nicolaides, and she just gives us a brief of what is happening in South Africa. Listen in.
Hi, I'm Gia Nicolaides. Here's your morning brief on the coronavirus. It's day 40 of the national lockdown and day 5 under level 4 of the regulations. We have another 437 infections, bringing the total number of COVID-19 cases to 7,220. The death toll now stands at 138. Health Minister Willem Kiese says with winter setting in, the country will soon be confronted with the additional burden of flu and other respiratory illnesses. So he is appealing to the public to stay healthy, to ease the load on the healthcare system. Almost 260,000 tests have been conducted so far, and that number is steadily increasing. Some positive news: a group of Cape Town healthcare workers are part of a trial that's investigating if a TB vaccine can also protect us against the coronavirus. Now, yesterday, approximately 1.5 million people returned to work under the eased level 4 regulations. But there's been a stern warning from the Labour Department that employers who fail to follow strict health and safety guidelines face being shut down and being criminally charged. There have been nearly 5,000 applications for relief funding from the arts and culture sector and 300 from sports. Minister Nathi Mthethwa says he will meet with the SAFA President Danny Jordaan and PSL Chairman Ivan Khoza about when local football could resume. No decision has been taken on when live sports will resume due to the contact nature of the sector.
Well, things are slowly but surely returning into normalcy in that is South Africa, and as Gia has explained there, it is slowly taking shape. And she's also talked about the TB vaccine that is being looked into to see whether it can help to prevent the people of South Africa from getting the coronavirus. That is just good news, and one of the steps that people are taking to make sure that we find a vaccine and a cure for this virus and keep on having hope. We have Masharia who's texted in and asema, I truly support the MPs on the issue of closing the borders, because at this rate we need to make sure that we protect our own people from this virus. If Tanzania and Somalia cannot do that, then it would be a challenge. But another Joyce is disagreeing with this and saying, if we close down the borders, please look also at the side of making sure that we have food that comes from these countries. That means our cargo will be locked down, and also we will have people suffering of hunger like we have seen in other countries. It is a right step, but we need to look into it keenly before it is implemented. Very good point there that has been raised by Joyce. Thank you so much, Joyce and Masharia, for tuning in today. And for you, Asante Sana, for tuning in and being part of This Is the Day. My name is Sarah Otieno, and I will see you tomorrow. Have yourself a lovely evening, and God bless.
For this and more of our shows, log on to www.familymediaonline.com to enjoy a wide variety of programs, from current affairs to testimonials and features, pastoral and inspirational shows, kids entertainment, and so much more. Also stream live on www.familymedia.tv.